Hello everyone, this is Dr. Shahriar. Those joined for the first time. Let's just discuss a little topic before we start the session. So, I hope so you'll appreciate that one. Sometime, I get question from the doctors, especially about, doctor, can you give me some idea about I don't have peer, I don't have this, I don't have that. So all those questions often it came to me most of the time. It's okay, but it's mostly a lawyer job. As you all know. So okay. So am I visible? I hope so. I'm visible right now. So let's just give a little idea about what are the top MSc courses for Australia, especially those are not having any peer or any those type of things. So it's for them. I hope so. It will be useful. I hope so. You all will appreciate that one. All right. So, if there is any interesting question about taking courses, please leave it in the comment section. I'll be happy to answer it today. So I'll take just 5-7 minutes before the other doctors are coming. I hope so the things are clear. Yeah. So top MSc courses. So many are, especially this question comes more from the those does not have the PR. So some of the courses might give you PR in Australia. But let me tell you, as a physician, as a doctor, if you pass the AMC, let's talk about that one. If you pass the MC1, if you pass the MC2, if you apply for a job and if you get a job, after that, if you work in Australia for 47 weeks, including some of the particular department like medicine, emergency, these particular subjects you need to cover. So total 47 weeks when you work, you will receive general registration. When you get the general registration, you can apply for the PR, including your spouse. All right. So this is the basic thing as a doctor, and it's quite a high listed. You might be asking that, doctor, is it what's the rank? Thing. It's a very top listed subject as a, because even when I was in Australia, I also talked to lawyers. Some of them also know me. So there was collaboration meeting happened. So that time I asked them so what are the like? So they said many doctor when they ask us, we said that please pass the both part of AMC, then come to us. We'll be definitely helping you, and it's for almost for sure that you will get the PR. So this is one of the thing, and it's like a process. It's always possible. It's alone you can do it, and also you can take some help from the lawyer. That's also possible. So MC1, MC2, get a job offer, start working for 47 weeks, apply for PR, including you and your family. The family includes, you, your spouse, your kids. That's all. Initially you can't apply for your parents. That's a different visa. You have to talk to the lawyer. Initially you can't apply for your parents. Later you can apply actually, but that process takes more time. These are the information so far, and now what are the topic? That is, highly listed, and I will be talking some of the things. Those are evidence-based, which I have seen. I have a lot of students. I have been observing this Australian system, but do understand one thing: every year July they change their system. So so at the time I'm talking, this is 2020. If anyone is watching this video in 2021, the policy things might be changing. So I should tell that one. So first of all, as a physician or as a doctor, which one you should consider? Of course, the AMC you should consider. Try to pass the exam as soon as possible. Some people get frustrated when they couldn't pass, and they say think that okay, other ways can be much more easier. That's it can be. It depends on the person how you're taking. Every line in this world is tough. Nothing is so easy in this line. So try to pass the exam. That's my first suggestion. All you have to do, study, pass, get a job. You don't have to think the different thing. You don't have to pay extra for that one, unless you have a lot of money. First of all, you want to invest and get it in a different way, and if you can't do it in through the Australian this AMC route. Then there are some other route, like many people I saw taking the nursing. This is one of the another popular nursing. So occupational health safety. Few days back there was a doctor. I mean, not few means like 4 or 5 months. I mean, 5 months back. Before I went to Australia, so one doctor came. She also got the peer from the occupational health and safety. So she confirmed that that's a peer listed subject. Nursing is a peer listed subject. One of my friend, he went through that route, but since he passed the MC, then he left that course actually. So some people, as a backup plan, they went to Australia, because if your visa is showing that you are inside Australia, the getting the job sometimes is more quicker. I mean, but it's not the essential thing, but just imagine in a logical way, one doctor who is already in Australia, one doctor who is not. But again, it depends on the city first of all. But staying in Australia is a beneficial point. Peer is not always that thing, but staying the visa status showing is more beneficial thing. Yes, of course, peer also is a beneficial thing. Yeah, but it's not the main thing always. So nursing, occupational health safety, sonography, social worker, okay, hospital management. But now it's probably changing the hospital management. But I have seen people getting peer on that one too. MPH, I mean, the highest number of question I got is from the people, they want to do MPH. Most cases is female doctors there. I don't know why they like MPH a lot. Even my wife is also doing MPH, so no offense first of all. Yeah, so I mean, maybe everyone thought that it's a very light topic. It's not. Those are studying, they know only that it's not that light as it seems from outside. So MPH, no direct peer first of all actually, and it's no longer remaining as a peer enlisted first rank subject. I mean, it's in the migration lawyer said it's like a ladder. You enter into Australia with this MPH thing, and later you can change the subject. Okay, so that can be an idea. Okay, teaching, I mean, there are some accredited courses, higher secondary, those teaching job. Um, it's possible. Not the thing I'm doing, that's not possible in that way, but there are some other teaching job. And of course, I mean, Google will always show you some fastest route. I mean, even if you see marriage, of course, I mean, no offense, that's another fastest route actually. Some of you already got it in this way. Congratulations for that one. I mean, they already are one step ahead. Now the thing is, it's very unfortunate if you have peer and if you're not getting a job, and if you're not passing MC, that's very unfortunate. That's quite a shame, I would say. I mean, in that case, like when you already get this peer, and if you can't get through MC, like you are doing injustice um, to yourself. So my job is to tell, comfort you, reassure you, but sometimes should be harsh to you as well. Like especially those people have already peer, and still you are lag behind. So imagine about the people who does not have peer, and they're trying their best, and they are managing getting jobs. All right, so that's I mean, I don't appreciate that one in that case. So this is not so tough, like for 3 months, 6 months to coming back. If you have some clinical gap, it's always possible to come back. Nothing is impossible in this life. So I mean, please keep it in mind that if you are a peer holder and if you're staying in Australia and your clinical gap is increasing, that's not a good news for you, even if you're a peer holder. So what's the solution here? Come back to country, start working, start applying later. Okay. So these are the certain things, I mean, I want to say. And if there is any direct question anyone wants to ask, and lastly I have to tell, like, no offense, like it's just the ideas I'm just sharing to all the dear doctors before we start the class. So if there is there any other question you like to ask me before I hand over the class to the other doctor? All right, so guys, question answer session now. Is there any other thing anyone else? So these are the subjects I have seen with the doctors. There are other subjects like engineering, IT. So for the general people, those are the subjects. But these are evidence-based. I have seen doctors taking this subject and getting succeed. With MPH, it's not possible to get succeed nowadays. Not directly, indirectly it's possible. All right. Someone asked, can we apply? I think I just answered that. Can apply here just after passing MC? No. After passing MC, you have to work there in Australia. Then you can. 47 weeks you have to apply. Yes. You have to get a job. Yeah, I already told that one. 47 weeks. It has to be rotation, it's medicine, emergency, and one department more you need to cover, and then you can apply for the, that's most authentic way, guys, to, I mean, get into the system as a doctor, and also get the peer in the most authentic way. You don't have to pay, I mean, so many dollars actually. You know, in life, one thing, of course money is important, but make sure why you're investing. I mean, sometimes we don't realize, I mean, from whom we are taking the money and the thing. Yes, your father might have a lot of money, but he earned it by himself. It's not you. I mean, sometimes. All right. So, I mean, it's a very big amount, especially those are doing the courses and the thing in Australia. So think twice before choosing those subjects. You have an authentic way. With AMC, you can pass it and get the PR rather than, I mean, spending the money just to get the PR rather than get married. I mean, that's the easiest way. All right. So any other things? All right. Thank you so much. I mean, Dr. Um, I'd like to hand over the class now, and